Yeah. All right, everybody, welcome to our second NeuroNights of this season, second NeuroNights presentation of the season. Again, if this is your first time coming to NeuroNights, this is our evening workshop series hosted by Ohio State's Chronic Brain Injury Program, the Students in Buckeyes Raising Awareness in Neuroscience undergraduate group, and also the Wexner Medical Center. And so today we have a presentation on functional neurology. It's a topic that we've heard, our survivors in the group talk about a few times and ask questions about. And so I'm really excited that we've gotten to connect with Delta Neuro Health at the last few fundraising and social events. Gotten to know them a little bit. Our students have gotten to tour their lab, or sorry, lab, their practice, and really excited to have Joseph and Justyna Coppus here with us today. Just a quick note to everybody. I think I posted this in the chat, but I'm going to post it one more time in case you can't see it. We have an open scientific lecture this Friday at 9:30 a.m. You can view it online, or if you're on campus, you're welcome to come to our location, which is all on that link for a talk on brains on the brink, early adversity, pediatric brain injury, and neurobehavioral vulnerability across the lifespan. So lots of cool words and very good presenter. And so if you're open to that and available, I encourage you to join. Outside of that, I would just say thank you to everybody who came to our community day over the weekend. It was really nice. It was our second one. A lot of the funds that support NeuroNights also support this community day, and it was a really great second iteration of what we've done. Big thanks to Layla Rudolph, who's on the call, who's our lead student on all things NeuroNights and Community Day, crushing it as she does on setting this whole thing up, and of course to Alexa on our team as well for coordinating. So with that, I think I'm going to just do a very brief introduction for um, Joseph Coppus, who's going to lead the presentation tonight from Delta Neuro Health. So you can see, he's a practitioner in this space, and he's going to teach us a little bit more about what he does. So, Joseph, why don't you take it away?
Awesome. Thank you, Kadar, and thank you, Layla, and everybody else who makes these NeuroNights possible. This is a really great resource, I think, for the community, and I'm honored to be able to present to everybody tonight. So, like you said, my name is Joseph Coppus, Dr. Coppus from Delta Neuro Health, and what we primarily practice is something called functional neurology. Now, this is a pretty unique type of practice in central Ohio and really Ohio at large. Most cities, I think, across the country are starting to gain these types of practices, but Columbus and Ohio have kind of been behind the times, more or less. So I wanted to come on and talk a little bit about what we do and what kind of unique things we bring to those struggling with neurological conditions to central Ohio and Ohio at large. Okay. So I first wanted to start by telling everybody a concussion story. So there was this patient who sustained a concussion when they were in high school. They slammed the back of their head on the underside of a table, right? And after that, they started to struggle with pretty bad headaches, just unrelenting headaches, brain fog, fatigue, nausea, and then eventually they started to develop syncope, where they were fainting constantly. They went to your traditional routes for care. Nobody seemed to really be able to figure out what was wrong with them. They had gotten an MRI. Everything on the MRI looked great. This patient started to feel like they were crazy. Nobody really knew what to do with them. Every time they tried to run and cross country, they'd feel sick and headachy. When they were in school, they couldn't focus. Until one day, this patient discovered functional neurology, and totally changed their life, helped them get back on track. They were able to complete their doctorate and speak to you all tonight. So this is actually my story. How I actually got into functional neurology because I was helped by it. And because I saw kind of how powerful it could be and was for me. And, I saw other patients as a student when I was learning it improve as well. I thought this is what I have to do with my life. I can't look away. This was my kind of red pill moment, if anyone's seen The Matrix. And so since then, it's been history. So that's why I'm here, and that's why I have that quote down here: "Change your brain, change your life." That's literally what happened with me. So, um, so the goal for tonight is to talk to you a little bit about what functional neurology is. I want you to have a better understanding of what it is. I want you to have an understanding of the fact that, how your brain adapts and rewires itself. And then I want to give you three simple strategies that you can use tomorrow to start, supporting your brain. Okay. So what is functional neurology? So people have commonly heard of functional medicine, I think, at this point, but may not be as aware of functional neurology, right? Functional neurology kind of follows a similar mindset as functional medicine in that we're trying to look at those gray areas that are often missed. So, with traditional neurology, traditional neurologists are typically really focused on diagnosing pathology, right? Which is incredibly important. But what I've found in practice is that a lot of kind of chronic issues tend to fall through the cracks, unfortunately. So, with functional neurology, we're not just interested in, say, the anatomy of the brain. We're also interested in pathology in the brain. We're also interested in how is the brain functioning? How is the physiology of the brain, right? So maybe somebody isn't operating at 100%. Maybe they're also not operating at 30 or 0%. Maybe it's they're operating at a level that's above pathology, but still enough where it's perpetuating symptoms. So a lot of patients that come to mind might be those with, TBI or mild TBI, especially, post-concussion syndrome that has not resolved for, months or years. These are the types of patients that we often see. So in order to understand then how functional neurology can benefit the patient, I think the most important concept that I can convey to you is the idea that the brain is plastic, not in a literal sense, right? But the sense that the brain can change, right? You're not stuck with the brain you have today. Your brain can change for the positive, and it can also change for the negative. Right. So if we're feeding our brain, garbage on social media and, all this negativity, that's going to create maybe a negative plastic environment. Maybe if we're not using our cognitive faculties and things like that, not pushing ourselves cognitively, maybe we start to regress a little bit. But then on the flip side, if we do something like um, learn the piano. That's why I have the picture of the piano here. I could sit down with a piano instructor tomorrow after never having learned the piano. And after an hour, chances are I'm going to have learned something, right? So that is an example of maybe positive plasticity. However, in order for that change to become permanent, I need to reinforce what I learned with repetition, specificity, and novelty, right? So I need to repeat this task in order for the change that I'm trying to make to become permanent. So this concept of neuroplasticity is what we apply to our patients, right? So let's take, I know this group is very interested in brain injury, of course, right? So if I have a brain injury, but it's not bad enough where it shows up on an MRI, and we can't see it on MRI. But, you know, I'm still struggling with symptoms like brain fog or light sensitivity and headaches and things like that. And we can do thorough testing to figure out maybe which networks and functions of the brain seem to be underperforming, right? Maybe your pupils aren't constricting and dilating appropriately after the head injury. Maybe your vestibular system has been impacted as a result of the head injury. Maybe your eye movements aren't moving appropriately as a result of the head injury. And these little things are perpetuating your symptoms. So if we can take all of those findings and find the common denominator in the brain behind, what might be the reason for your symptoms or for those negative objective findings. We can say this part of the brain, these networks of the brain seem to be impacted physiologically. Then we can say with more certainty, let's go after those areas using specific brain-based exercises and therapies. And therefore, we can be more specific and clinical with the concept of neuroplasticity and create that positive change we're intending to. So, what are some common reasons why the brain might get stuck? So, things like stress in your life, trauma, injury, head injury, right? Sleep, lack of stimulation and proper development, poor diet, inflammation, infection, which can lead to a whole host of symptoms. So, I alluded to this a little bit, but here's a little slide on our process in our clinic. So, number one, we need to assess the patient. All of you here tonight can probably appreciate how complex the brain is, right? And no brain injury is ever the same. No two brain injuries are ever the same. I could have a brain injury, and then my wife could have a brain injury, and our symptoms could be completely different. The pathways in our brain that were disrupted can be completely different, right? So, how do we understand what's going wrong with each patient on an individual level? We have to do a very thorough assessment, right? So, our assessment is 3 hours long of bedside testing, computerized testing, so on and so forth. And I'll give you some examples of that here in a little bit. And then once we understand physiologically what's going wrong in the individual's brain, then we can create a more specific and individualized treatment plan. If we're trying to rehabilitate the vestibular system, maybe the right vestibular system, we're going to do specific exercises that upregulate that right vestibular system. If we need to um, rehabilitate eye movements, like we're pointing to in this picture above. We're going to do specific exercises that rehabilitate those eye movements or the regions of the brain that control those eye movements. So it's very specific, and it has to be. So here's just one little example of treatment approach. This is called the Dynavision. This is a hand-eye coordination. Um, exercise, and I'll show you a little bit more here in the next couple slides. So, and then we try to take a very scientific approach to our care, right? So we don't want to just base our treatment plan off of the patient's symptoms, and we also don't want to base our treatment plan just off objective findings. We want to marry the two, figure out what your goals are, create a treatment plan around those things, and then put our theory into action. So we're going to do things, constantly check things. Are they improving? And then ultimately, we want to do a reassessment. We want to see, are the objective findings that we set out to improve, are they improving? Are the symptoms that you're struggling with, are they improving? So long as they are, that tells us that our theory is sound and we can continue with care or, conclude care, graduate you. So here are a few interventions that we might perform in our clinic. So the top left, you'll see the patient hooked up to those Normatec boots. This is called tilt table therapy. We do this with a lot of patients who might be struggling with something called POTS or dysautonomia, orthostatic intolerances. Um, This is a pretty common manifestation for people post concussion or post TBI, that will address this way. In the middle, you'll see this QEEG cap. So we do perform some neurofeedback therapy. Top right, you'll see us doing some eye movement therapy, some Brock bead convergence training. Bottom left is some more optokinetic training. Can be helpful for balance or dizziness. And then we might do some things like complex movements or things that um, using these infinity motions or different body sensory integration type of exercises, we can actually feed into, a side of the brain that we want to affect. Okay. So here's just one example of a patient who came into us. So one of the tests that we run, it's called the C3 Logics. It's through the Cleveland Clinic. This is a standardized pre-post concussion assessment tool. So what it does is we can look at the symptoms that the patient is coming in with, and then we can keep track of those symptoms over the course of their care, right? And we want to see the symptoms improve. We also have a really solid cognitive assessment that we can pull from. So here on the left, you can see that the patient had a lot of moderate to severe symptoms after working with them for, I think this was about 2 weeks, 2 to 3 weeks. You can see the shift, from orange and red to green and yellow, right? So this patient had a lot of symptoms. A lot of TBI survivors, mild TBI patients, have a number of these symptoms. So it's great when we can see all of these shift towards the positive. You can also see that some of their cognitive assessments improved. So their standard assessment of cognition improved. That's the SAC. Their trails following, trails A, trails B. Their processing time, this particular one, that stayed the same. The reaction time improved, and their choice reaction time improved as well. So this is what I mean. We want to see both the symptomatic subjective improvements as well as the objective improvements. Here's another good example of objective improvement. So one of the most important things that I look at with um, TBI recovery and concussion recovery are eye movements. The eyes, I always say, are the window to the brain. We know what the eyes are supposed to do given certain tasks, and we can see, are the eyes in this patient doing what they're supposed to do? If they're not, what does that mean neurologically? So here's an example of a TBI case. So in the video, you can see the blue line, that sinusoidal blue line, that is depicting what the target was doing that the patient was trying to track. Okay. And then the red and the green line, that was depicting what the patient's eyes were actually doing. So they're trying to pursue this target left and right, and you can see they're all over the place. Now, this patient had things like headaches, they had focus and attention issues. And when you look at the eyes in this way, you can say, yeah, no wonder they had those symptoms, right? So same thing. After a few weeks of therapy, these were their eyes. So you can see that their eyes are pretty smoothly overlapping the target. This person is, you can imagine, more focused now. They're not getting that same like neck pain and headaches as a result. And if you don't believe me about the eye movements and the neck, really quick, if you all can kind of put your fingers behind your head, just kind of these two fingers, put them behind your neck, that below your occiput, and then move your eyes left and right. And you can feel those muscles engage underneath your fingertips, right? So just imagine this person, this first person, or sorry, the person before the treatment, their eyes are skipping all over the place. That's going to cause their neck to tighten up. That's going to cause referral headaches, so on and so forth, on top of just the focus issues and the dizziness, the inability to keep up with visual motion in the environment, which can cause dizziness. So these things, a lot goes back to the eyes. So this person was feeling a lot better after this. Um, and then here's just some examples of some of the cases, some of the patients that we often see. So TBI, MTBI, post-concussion syndrome, we see a lot of vertigo and dizziness, migraine, POTS dysautonomia, developmental delays, PANS and PANDAS, stroke, seizure, different movement disorders like tics and tremor, Tourette's, sometimes things like that, sensory processing disorders, memory, cognition, anxiety, depression, neurodegenerative disorders like Parkinson's, uh, some Alzheimer's. Some people come to us for performance enhancement. I would say this is a pretty small percentage of our clinic, but there are some higher level athletes who, they just want any edge they can get. And so we work on improving, hand-eye coordination, reaction time, processing speed, all the things that might improve their performance on the field. So, now that you've listened to me drone on, I want to pass it over to my wife because this is going to be kind of a dual presentation. So, I'm kind of talking about what I do, and then she works with me here in the office. Um, but she also has a pretty powerful story as well. So, I wanted to pass it over to her now.
Do you want to shift the audio or?
Yeah.
Okay. Okay. Can everyone hear me okay? Oh,
Yep, we got you.
okay. Is my audio coming through? I just want to double check before I get going.
Yep, sounds good. Can you hear us?
Oh, yes. Okay, there we go.
Oh,
Okay. All good now. Thank you so much.
all right.
Sorry. Thanks you guys for
Yep.
your patience. Can you go one more slide over? So my history for my traumatic brain injury takes me back to December 2012. I had a traumatic brain injury while skiing. I went into a terrain park with some friends, hit a block of ice, went up into the air, caught too much air, and landed on the back of my neck. So I was immediately knocked unconscious. And thankfully, with a group of friends where someone noticed me fall and ended up going back up the Black Diamond ski at the ski hill at the time and helped kind of try to bring me back to consciousness because I was blacked out for probably about 60 to 90 seconds and then was taken down to ski patrol. I was assessed. They determined I had a major concussion, and I was taken with an ambulance to a hospital in Wisconsin. And they ran all the testing. I think I had so much radiation done over the course of that hospital visit, and then the 3 to 4 months that followed, and they could not detect anything. But I went back in a neck brace. I couldn't really move around for 2 weeks. They just told me to sleep and sleep off the concussion, take a break from school, drink a lot of fluids. And I struggled pretty severely for about a year and a half with kind of a mixture of short and long-term memory loss. I had short-term memory loss in that I couldn't remember things as they were happening in real time. But now, if I reflect back on that time, this was during my high school year. I sustained the concussion and the brain injury in December. So, after one semester of high school. And in my brain, my memory regains at the end of my sophomore year. So, sophomore summer is where I have memories again. So, in real time, as I was going through that period, I didn't have any memory. And now it's sort of that long-term memory where I have this chunk of memory where I can't really recall anything. But during that time, it was really interesting because my brain sort of rewired. I was more health science, math based in my approach to learning. And instead, I went through this dramatic shift where I suddenly started connecting more to like history, literature, arts, very different types of subjects. And the only way I could recall things was by writing them down and working one-to-one with a lot of really helpful teachers at the time. But eventually, this sort of working through my high school educational time and rewiring my brain and working slowly through the memory, it allowed me to regain regular like memory where I was able to function in school and do better throughout the second half of high school. And then spring of 2015, I sustained another minor concussion while swing dancing and finally was in a more stable place for about a year. And something about just that small little head bump escalated all of my symptoms. So I started to have really severe headaches and dizziness. The memory had gotten better, but it felt like from that point on, everything started to go downhill with my symptoms. I wrapped up high school, moved on to college, and in college just went through normal stressors of that transition and started to get really debilitating migraines at about the same time that I got a really severe sinus infection that was causing me to have to, I was getting dizzy spells, having to take naps, and just like not able to be upright for 3 months where I had to go on antibiotics. And with that combination of the sinus infection and migraines, all my pediatrician in high school and then all the doctors at the time that I shifted to, they were trying to figure out what was going on. And so I was seeing a few ENT specialists that then referred me to neurologists. And over the course of my college timeline, I had seen 4 different neurologists. I was on all every medication I could imagine for migraines. They just kept shifting me for 3 years. And over the course of that time, it kept getting worse and worse. So I had a point in college where I had 15 to 30 days a month where I had a migraine. So some days it never went away. And a lot of times the recommendation from the doctor was take the medication, take a nap, wake up. Hopefully you'll feel better when you wake up. And sometimes I did, sometimes I didn't, but unfortunately that meant having to shift my academic studies to where I had to go on academic disability at the time. So I was making my way through college, kind of struggling with these really severe migraines. And about winter of 2018, I had a friend of mine who just mentioned functional neurology to me for the first time. Her sister had a similar experience with a concussion and then had very severe migraines for years. And she couldn't get any help and finally went through a treatment program at a local doctor's office and got the help that she needed. And I was like, I have to do this. So that winter, I remember I called and I was like, I got to do this. It feels right. And I found out that my insurance wouldn't cover it. And like any broke college student, I was like, I got to get through school, but I also, if insurance isn't going to cover it, I'm going to have to work and save for it. So I took a semester where I took fewer credit hours. I worked a little more. I saved money. And then that summer of 2019, I went into that same functional neurology clinic I heard about from my friend. And I finally got treatment for my migraines. I went in for about 6, 7 weeks for treatments. And I got my migraines down to once a month just in that time frame. And for me personally, I wanted to spend more time and allocate more time on it over the summer since I knew I was starting up one more semester or one more year of school. So I did a few more weeks of therapies and I got it down to where I was only having hormonal migraines once a month. I worked with my doctor to get therapies and treatments that I could do at home. So I remember especially as I went into my school year, I had a little bulletin board where I put all the therapies I could do at home and I'd have like a routine of doing them before I went to bed each night. And I just continued that as I went through my last year of college. And it brought my migraines and my health to such a stable place that I remember being terrified of like, oh, like I love school, but I can never continue in education because it was so hard to get through college with my migraines. And they got so much better within that last year of college that I ended up starting grad school and I did a 2-year master's program after that and continued my education. Today, I can say that my migraines rarely happen. Every now and again, I get some like neural flare-ups or things that are mostly more like diet or environment related, where something will trigger it. But um, I I really within a year probably got my migraines down to once a quarter once I addressed the hormonal issues I was having at the time. And now it truly rarely happens. So I'm grateful for that. And that has been my kind of personal testimony to functional neurology. I had kind of a lot of different paths that I tried before I got there. But I think it's also what makes me so passionate about our clinic and the work that we're doing. And both Dr. Coppus and I have our own backgrounds and different stories that brought us to here. And so, if it is helpful, I'm happy to address any other questions about my story or personal testimony. But I wanted to give a little bit of insight kind of on how that looks, and what it can look like in real time for somebody. Are you going to shift back over, or do you want
I can shift back over.
to? Okay. Sorry, we got a couple more things for you guys, and then some Q&A stuff.
Okay. I think I might be back on.
Mhm.
Okay. Yeah, so thank you, Justyna, for sharing that. We're just right across from each other right now. Um, so yeah, just some practical takeaways I wanted to leave everybody with. Oops. So three things for the brain, movement and balance, and how important those things are. You know, movement is life. Movement helps to, keep your brain young. Um, so the more you can move, whether it be, cardio, that helps with neurogenesis. It helps with vascular neogenesis. Basically, that means, cardio exercise helps with the formation of new blood vessels all throughout the body, including the brain, as well as helping to stimulate neuron growth. Uh, Same with um, resistance training helps with something called BDNF, or brain-derived neurotrophic factor. So it helps aid in, the brain's ability to its plasticity essentially. So movement and balance, very important. And one thing with balance, there's actually studies that correlate your ability to single leg stand with your cognitive ability. So they see with mild cognitive impairment, as cognition declines, so does your single leg standing test. So for your age group, it's always you can actually check to see, can I stand on one leg as long as I'm supposed to? I did not include those numbers, forgot to include those. But, something you can do if you're able, try to put your shoe on with one foot or standing on one foot, pick it up, put the shoe on, tie it, do the other one. Is a nice little daily exercise you can try if you're able, asterisk there. Breath and calm. So very important to keep the nervous system regulated, especially our parasympathetic nervous system, that rest and digest nervous system. The brain needs three things to survive: stimulation, glucose, and oxygen. So really making sure that, we can oxygenate the brain and the body in a way that is productive for it. One method I like to recommend to a lot of patients is uh, boxed breathing or accentuated exhalation. So if we breathe in through our nose for a count of three, and then we breathe out through our nose for a count of six. So accentuating that exhalation, this helps to get us into more of a parasympathetic or that rest and digest state, away from that fight or flight state. So simple daily practice. Do that for 30 seconds to a minute, just when you're feeling a little anxious. And then it's always important to learn a new skill. So whether it be, reading, continuing to read, continuing to learn, going to the research series that you do once a month, coming to these lectures, learning a new language, learning a new instrument, learning how to dance, learning a martial art, all these things are really positive in impacting the brain and supporting neuroplasticity. Simple thing you can do tonight is, if you're right-handed, try to brush your teeth with your left hand, or vice versa. see how challenging it is, give your brain these novel things, challenge it. So there's a few just simple takeaways. And I guess I put this in here, but we're doing uh, concussion baseline screenings in our office. So if that's something you're interested in, feel free. We'll be here during these days and these times. So, and it's free to the public for student athletes. So yeah, yeah. So thank you, everybody.
Yeah. Awesome. Thank you both for sharing all this. And, I really love the idea of, the personal and the professional components mixing in. And Joe, I didn't know that about your story as well. So that's pretty cool.
Yeah.
Um, we will open it up for questions. So folks, you can ask your questions out loud if you just unmute, or if you feel more comfortable, you can type it into the chat. Um, I'm just going to start that off with one question I have. Um, so you both were helped by functional neurology or functional approaches writ large. Um, since then, and I know it may not be that long, but the field changes quite quickly.
Mhm.
What do you feel like has changed in the practice or approach, maybe in the environment, around functional medicine that's kind of important to note or consider?
Yeah. Well, research, as you probably know very well, is always changing. The brain is the next frontier in healthcare, so we're always learning new information. We're always getting better. We're always, pushing the boundaries of what we know, and trying to get more specific with each patient. You know, I'm always taking updated courses, and it always shakes my foundation as far as my therapy or my treatment approach. But I think that's good at the end of the day. It keeps my brain sharp and it keeps my approach effective, I think. So, yeah, it's a good question.
Just data from your perspective, have you seen things, be different now that you're in the practice and not just the patient? And how do you take that?
Yeah, I think sorry, I think the biggest thing that I've seen shift is just maybe more of like a heightened awareness from people about like how much our environment impacts our brain or our neurological health. I feel like I've seen a lot with like in Columbus, we've had a lot of POTS patients, and that's been just really eye-opening to see their experiences through functional neurology, and kind of just like lingering like infections or viruses or like what effects those can have on people's health and the like neurotoxic component to that, and environmentally as well, just kind of how like heavy metals, molds, like with Lyme disease, how these things can kind of sit in the body and have such a intense effect sometimes on the brain. I think I've been really surprised with that in seeing that since we opened our practice, and I feel like things are maybe shifting more in that direction where there's maybe more of an awareness to the correlations or how those things impact each other, where it's not so segmented as it used to be, which is a good thing. So I've been interested to see that more integrated.
Awesome. Um, Bhavna asked in the chat, does your practice accept insurance, especially OSU's health plan?
Yeah, that's a great question. So we don't accept insurance outright, unfortunately, at this time, but we do offer patient super bills, which is something they can submit to insurance for out-of-network reimbursement. Um, yeah, just the nature of it. Insurance can be somewhat prohibitive towards, you know, what a practitioner does. So we like to work unencumbered by insurance, but still try to get patients the benefit by supplying those super bills if we can. So, yeah.
And then I think a follow-up here was, are the concussion baseline screenings only for those that have had a recent concussion, or maybe for someone who has had it in the past to get like another screening to see how they're doing with maybe post-concussion syndrome or other symptoms at large?
Yeah, good question. So I think our intent initially was mostly with student athletes or athletes who, wanted to get their baseline prior to the season in the event that they might get a concussion, so that they at least have that baseline data prior to sustaining a concussion, so that we know, where was their baseline prior to the head injury, so that we can compare that after the head injury and kind of gauge how, um, I guess, offensive that was to the brain. Um, but that being said, it's open. So if you're just curious about where you stand, feel free to come in and stop by if that sounds like it could be relevant to your particular situation.
Cool. Yeah, we do some research with youth football teams and things like that where they get that, that baseline at the beginning of the season. And I think outside of projects like those, it's really hard to get that type of that insight.
Yeah.
And it is really important to kind of follow
Mm.
along throughout the season.
Yeah, absolutely.
All right. Other folks with questions? What's the cost? We're very
Okay.
practical with these questions.
Yeah, I'm getting right to it. So for a 3-hour evaluation, it's 500. Um, and then for the treatment following, it depends. We typically will see patients for 30 minutes or 60-minute therapy appointments. And that will make that recommendation based on your the complexity of the case, the severity, um, you know. But if it's 30-minute appointments, therapy appointments, it's $120. If it's 60 minutes, it's $240 for an hour. So, yeah.
All right. Melody, I see that you unmuted. Did you have a question?
Yeah, it takes me too much to type. Is there some activity or something I can do to deal with my long-term exotropia? Because my brain only pays attention to one eye at a time.
Mm-hmm. So potentially, yeah. And I don't know your particular case, but it's hard for me to say definitively, but we do look very closely at eyes and, the eyes working together, independently and together. So that is something we would consider, part of our testing. But I wouldn't be able to say for certain unless I, saw or got a little bit more information. But generally, yes, that's something that we do look at.
Okay, thank you.
You're welcome.
Kelly?
Thank you, everybody. Joseph and Justyna, I think you both have the most incredible stories. And I can't imagine that anyone else, when you talk about how you met or your relationship, has the same nuanced experience that you guys have had. That it was really powerful. Thank you for sharing. I had a TBI 2.5 years ago, and what kept going through my head in hearing all this is I can live with most of the day to day. I lost hearing in my right side of my hearing on the right side. I lost taste and smell. I had a long climb back physically, but for the first time in 2.5 years, I took my bike back out on the simplest trail that I could have done because I just my balance is still an issue, and it's more of what everyone is talking about, the doing two things at once. So just a long story short, I now have 10 stitches in my leg because I walked up a little bridge path, and then what the hell was I thinking to get on my bike and try to go down it? And I fell, and the pedal kissed my leg. We'll say it that way. So I it's disheartening because I've made so much great progress and I wasn't doing crazy things. Like I told my neurologist I would never become a boxer or take up flag football or anything, but I go do something that I love, and I kind of got a huge surprise. So I guess my question,
Mhm.
2.5 years post, what can I do other than getting back on my bike and I don't know, just staying on pavement? But what can I do to prepare myself or be better prepared? Like, what kind of therapy would you recommend?
Yeah. I'm going to answer, and then I think Justina wanted to chime in as well. Um, so giving blanket therapies, I couldn't necessarily do for balance because, I mean, you said you had a TBI. Um, there are a number of things that can be involved in somebody feeling perpetual unsteadiness, imbalance, right? So I like to talk about the three main things that keep us upright and balanced. That's our vestibular system that tells our brain where our head is relative to gravity. All right. So it sounds like you have some hearing. You said you had some hearing issues, so it's possible that there's something along that pathway that nerve, the vestibular cochlear nerve, it transmits vestibular information and hearing. So maybe there was some injury along that pathway. We also want to think about proprioceptive or somatosensory system. That's, what is our body telling our brain as far as where we are in space, right? And then third, we've got ocular motor or visual, right? What do our eyes tell our brain as far as where the environment is relative to us? So if it's an ocular motor issue or a visual issue, that's a different conversation.
Right.
If it's a proprioceptive issue, that's a conversation. And if it's a vestibular issue, that's a conversation. And sometimes we can even see, so the brain is kind of like a computer, right? So it's going to receive the sensory information from those three sources, among others, right? To tell us where we are in space. So it has to receive that information, process that information, and then create an appropriate motor output, right? So maybe it's one of the sensory inputs to the brain that's the problem, but we could also see problems after TBI in the actual processing of that information, right? So more central structures. So unless I actually was able, and that's where,
Mhm.
brain injury is so nuanced and so specific to each individual that it would be a little dangerous to give just general recommendations, unfortunately. Um, but yeah, I hope that answers your question without, yeah. Um, so Justina, you wanted to chime in?
Thank you.
Yeah, I think something I wanted to chime in and mention because it's hard to go into like all the nuances of something. I kind of tried to give like a history or timeline, but when my situation was at its worst, like my migraines, I had a migraine with aura, so I had visual disturbances. Sometimes I couldn't be outside just because the light was too much. I had a hearing sensitivity, so I'd have to put like noise blocking things out or tune out with music, get heightened anxiety just being in a crowd with the or like a concert with the noises. But I also had a really hard time with my balance to the point where I would like always felt like I was gonna vomit, like just because of the dizziness. So I had food sensitivities. I couldn't eat meat for 2 or 3 years. And I grew up running. And for it was probably the second or third year where I couldn't run. I want to say 2.5 to 3 weeks into functional neurology, I went for a run for the first time. And I remember just being like absolutely shook because I'm like, I haven't done this in years, or I haven't gone more than a mile without actually vomiting because I feel like it was just too much input to my body where I was trying to move and do all these things and my brain couldn't function. Um, so I guess this to say, there my body was beginning to compensate for, I believe at the time it was the left side of my brain was shutting down after that original traumatic brain injury that went unaddressed by the medical world for so long with my care, that it was showing up as migraines. But in the scope of my exam, when I went through functional neurology, we were able to pinpoint like these symptoms are happening because the eyes aren't tracking and this part of the brain's compensating for what this part's supposed to do. And now there's neck pain. And like there were all these components that weren't talking to each other. And for me, I came in 3 to 4 times a week for that summer when I went through treatment. But it made a world of a difference just in a few weeks of having that like positive reinforcement through the therapies that my brain was needing to rewire. Um, so I just wanted to share that because I remember like I felt like I was in a place where I'm like, there's no hope and how am I ever going to move again? In 2022, I ran my first marathon. So this has continued. It has been okay, but it's crazy to think back sometimes to go from like one alternative to another.
Oh, thank you so much. You've given me a lot of inspiration and hope. I appreciate it.
And just to piggyback off of Kelly's question, right? So, Joe, I know you can't give it like a sort of a blanket, here's what you would do, right?
Mhm.
Very personalized. Um, but I think to the point that it is possible to prepare oneself or to do some things that are elementary to help with return to activity in that way.
Yep, yep, absolutely.
Um, I'm not seeing any other questions in the chat or anybody with a hand up. So I'll ask another question. Um, so you gave us quite a bit of range of the types of conditions that you would work on and the dynamics of things that you would test and intervene and work on, and then again, right, reassess. Um, what are the things that you don't do? And when you don't do those things,
Yeah.
what kinds of professionals do you collaborate with, or maybe it's family members? Like, what are those kinds of things that are, you know, things you might see in your practice, but you don't necessarily address directly?
Yeah, great question. So we don't do surgery. We don't prescribe medication, right? We don't do that here. Sometimes people need medication, right? And in those cases, we refer them to the appropriate sources, or providers. Um, we will work, intimately with, whether it be a cardiologist or their medical neurologist or even their PCP, chiropractors, physical therapists. We don't tend to step on anyone else's toes. We provide a pretty niche service. Um, so there's a lot of great providers in Columbus, and so we've been slowly getting more accustomed, or I guess acquainted with those providers. Yeah, we're not a one-stop shop, so we make sure to collaborate when it's necessary. Um, yeah. So, what else don't we do? Yeah, I mean, yeah, that's pretty much, yeah.
Yeah, conventions. Sorry, I was just gonna say, something else we do offer in our clinic is we offer a free phone consultation for all patients. And we like to do that because if there's someone who's struggling with something and they just don't know where to go with the answers, and we feel like the next right stop, but we know that there's an in-between step before they come to us, or there's something else that they're dealing with, or needing to detox something out of their system, or something that's a much higher priority than the neurological symptoms. We work closely with other practitioners to integrate them into other areas of care. So if they're needing to go somewhere else before they come through our doors, or you know we're not just trying to push someone through our doors, like we really genuinely just want to help. So we like to do that phone consult to make sure that the patient is a good candidate for functional neurology. And if there's someone else we know in their area, or there's something that is a higher need or takes precedence over functional neurology at the time, we try to help them find the next right step if it's not us.
That's great. That's great. I mean, it is a windy, twisty road with brain injury, right? So, um, I'll give you one last question that I have that I think is something that we try to do with presentations from service providers, especially those that are novel or sort of still new in the field, right? Um, so it's green flags, red flags. So in some sense, right, not every practitioner is the same. Functional may be a word that gets thrown around to some degree. And so, let's assume, we're not just talking about your practice, but we're talking about the field in general. What should people be looking for if they're, seeking functional medicine or seeking specifically functional neurology? Um, what would you say are green flags, things that, say, okay, this is a practice that you could consider? And what would be red flags where you think, hey, maybe this is not exactly what you think it is, or maybe not the right fit.
Yeah, love that question. I'd say green flags, you've done the traditional route, everything is medically fine, more or less, right? But you're still symptomatic, you're still struggling with dizziness, headaches, light sensitivity, you name it. Um, but nobody's really kind of given you an answer or maybe a satisfactory answer, or you've not gotten resolution and it's been months to years and you've done the more traditional route and you feel what you feel. I think those are great candidates for us, people who we can really go in with a scalpel and fine tune and try to figure out, what is still lingering, what is still, causing this person to feel the way they are. And then we come in and provide that, hyper personalized care and, try to get them, the next few steps further, as best we can. Red flags, if it's an acute, you're starting to have immediate facial drooping and your arm gets tingly and you're slurring your speech immediately, don't call us, call 911, right? So kind of those acute immediate issues, don't call us, right? That's what the ER is for, that's what medical doctors are for, that's what they do great with, mental health crises as well. If you're going through, a crisis situation, we're not the ones to call for immediate help, right? There are more appropriate means or appropriate sources for that. So those I'd say are more the red flag situations. You know, and a lot of neurological conditions are helped by medication, and that's not our bag. So in those cases, that would be a red flag for us if that's what you're looking for. So and if you're not, I guess, willing to put in the work because it's not easy, right? Like I ask a lot of my patients, not just coming in here and going through the therapy, but I also expect them to do things outside of the clinic, right? Because I know it's not an easy road typically. So I have high expectations, and if that's not something that you know, resonates with you, then we may not be the best fit. Oh, and
As we
just
talk
like
about in the group, it's really about finding the right practitioner for you.
yeah,
And that might not be the first person you talk to.
right.
Yeah, and I just wanted to add to what Joe means about like the high expectations is there's a lot of lifestyle factors, or like he may send patients home with therapies to help reinforce that neuroplasticity and what he's working on in sessions. The like best outcomes from patients are the ones who like make the adaptations, like they make the changes, they reinforce things in their lifestyle, they take therapies home with them and they work on them outside of just the hours that they're in the office. Those are always our best cases. So there's always expectations, but then we work one-to-one with patients based on their realistic situation. But I did want to add to another green flag is we get a lot of patients who sometimes, for better or worse, they just I think diagnoses are good in the medical field because they help give awareness or validation to what a patient is dealing with. And we also get people who kind of on the flip side come to us because they feel boxed in with their diagnosis. So I'd say another green flag for us is people who maybe they have a POTS diagnosis, but then they're experiencing 10 other symptoms that don't feel like they're under the description of POTS and they're not sure what's happening. They've been to a couple different doctors and they're still just not seeing the results or getting the answers they want. So I'd say a lot of times patients who feel kind of boxed in by conditions or diagnoses that they've received, especially if they're neurological ones, sometimes it's not that black and white. There's more complexity to what's going on.
All right. Well, we are at time. So first off, thank you, Joseph and Justina Coppus, for coming and speaking to us and sharing more about your practice and approach. I think this is really, really helpful for me to kind of learn a little bit more in depth on sort of the approach and how we see things as you said, sort of niche, but also very important, and how do you balance all those things together. So I appreciate you for coming out, and looks like you're getting some, positive comments here in the chat. Um, for
Yeah,
everybody, oh, go ahead.
I was just gonna say, attention is a very valuable resource these days, and I appreciate you all, giving me yours tonight. So thank you.
Indeed, there's a lot of things to click on, right?
Yes.
Um, So I will just point out that we have a Survivor story here in 2 weeks. So we will hope to see you all back there for that. And then we will have again our next educational session at the beginning of November. And Mary Beth Amrian, who's on the call with us, is going to be presenting there on. And I'm now having a brain fart on this. I think it's supplements, but I wasn't 100% sure, right? Supplements? Okay. So I think these will be some really good talks this whole season. And so, again, thanks to Delta Neuro Health for coming out and sharing with us. So have a good night, everybody.
Thank you.
Bye, all.